we're taking a look at the argument for market-based reforms when it comes to the United States healthcare system. I've drawn for us a quick supply and demand curve of this market for medical services. And what we'd like to know is really what is this basis of these market-based reforms. And to have a better idea of this, let's take a look at this graph. And we know visually that our equilibrium should sit right here. So suppose that that's at a price of P0. But what happens in the United States right now is because a lot of our medical costs are covered by either employers or government assistance, and this is due mainly to this Affordable Care Act, right? It allowed greater government assistance when it comes to medical supplies or medical assistance. So people's demand for medical assistance, medical services, has increased from D to D1. And what we see that exists here is that not only has the quantity of medical supplies increased from Q0 now to Q1, but we also see that the price has increased from P0 to P1. But what's interesting here is that even though the overall price of the services we receive has increased, the price that we as consumers pay has actually dropped, and we pay at a value down here, and this is due to this assistance that we receive. So we're still getting the same quantity right here. However, our price is much, much lower. And the argument for these market-based reforms is that this shouldn't necessarily be the case, because looking at this, we see that the medical services market behaves very, very differently from any other goods and services market, which resembles a more competitive market. So the argument for these market-based reforms suggests that we should adjust this model so that instead of consumers paying only a fraction of the price, we instead pay the actual equilibrium price, which would sit right in here. Because if this market were behaving as a perfectly competitive market, we know that we would pay at price P0 to receive quantity Q0 instead of increasing our demand due to the lower cost that we're now able to pay at the price of somebody else. And so as a result of this current model where our demand does increase, what we see is decreased economic efficiency. However, if the market were to be reformed to behave more competitively, we would see an increase in economic efficiency. And we know that because we wouldn't be consuming those medical services that we don't actually need, which is currently the result of our lower medical costs. So we would see an increase in economic efficiency. We would see an increase in competition. And ultimately, we would see a reduction in costs. And the reason this reduction in costs would occur is because our current price that sits up here, this is the market price. So even though we as consumers don't pay that, somebody is. So cumulatively, this market price sits at P1. But if this market were instead allowed to behave as a more competitive market, we would see prices sitting at P0. So costs, this market price would reduce from P1 to P0. Economic efficiency would occur because we'd be consuming less. So we'd go from Q1 to Q0. And competition would increase because all of a sudden there wouldn't be this influence of fractional medical service payments.